Welcome to another episode of the Semi-Related Podcast. My name is Jacob Eischen. Today I'm joined with our good friend, Mark Manera. Mark, how are you doing today?
I'm doing really good. Thank you so much for having me on. I'm excited for the conversation.
Yeah, I'm excited to have you and to kind of dig into this conversation around truck driver health. In prepping for this interview and conversation, I listened to a couple of other podcasts you've done. I wanted to kind of get your idea on which one's been your favorite so far and how those have gone.
Yeah, man, I feel like I've been on like a ton of different podcasts you have like the circuit of podcasts in the trucking and logistics world. And so Nate Schutz, Kevin Hill, all the Trey Griggs, all those guys are great. And there's a million other ones that I've forgotten, but those three I've always enjoyed talking with them.
Yeah, there's some big content powerhouses in this space, but let's turn the focus then to you, and I want to get some information what your background was and what brought you to the transportation landscape.
Yeah, man. So 3.5 years ago, I didn't know a single person in the trucking industry. No one in supply chain, no one in logistics. My background is I have a doctorate degree in physical therapy, and I was working in a PT clinic here in St. Louis, and outpatient clinic, a bunch of knee replacements, a bunch of hip replacements, shoulder surgeries, general like musculoskeletal issues of people coming in with aches and pains, and walked in a bunch of truck drivers. And it was really my first time getting to know, some drivers on a personal level, the industry as a whole, just learning it from the perspective of a driver. And then also seeing what, 20, 30 years behind the wheel can do to someone's health. And that was really the spark of all of this and threw me down this rabbit hole of the trucking industry. And there was one driver in particular that I worked with that I just really meshed with. And I worked with him. He had just had a total knee replacement. He day one after having a surgery, literally less than 24 hours after he got out of surgery, hobbled into my clinic, and he was in crutches, still a little loopy on pain medicine. And we just hit it off, and I worked with him for a couple of months, helping him rehab his knee. And he was 37 years as an over-the-road truck driver, and talking about how much he loved trucking, his career, told me some of the big fish stories that every driver has throughout their career, and tell about how much sacrifices he made as a driver, and just being in the industry as a whole. And he had 5 kids, and had been married throughout his whole career, and how much he loved trucking, and how, amazing it's been for keeping a roof over his family's head, and, food on his kid's plate, but also just, sacrifices he's made throughout his career away from his kids, and how focused he is when he's at home, making sure he is the dad he wants to be, the husband he wants to be, and, how he balances all of that out on the road as well. And, as I went through the rehab process, and any physical therapist does, one of the questions you ask is, so, before the surgery or before this injury, what were you doing for, physical activity, or what were you doing for your health? Because our goal would be, let's get you back to doing that, or even better than what you were previously. And so, I'm stretching this guy's knee out, because during, a knee replacement, you gotta push a little bit to get the full range of motion back. And I'm, saying, hey, so, before you had this surgery, what were you doing for exercise out on the road? And, the typical response you get from someone is, yeah, my doctor asked the same thing. I need to be exercising more, or, yeah, I get it. I should be exercising more. And I asked this driver, and I was like, hey, out on the road, what were you doing previously? And he paused, and he said, I'm a trucker. We don't exercise. And it was funny in the moment, but it was really the first time that I honestly saw, just from a cultural standpoint, of just man, there's a real mindset here of they signed up for this, and they feel as though it's part of their job description to kind of be unhealthy. And as I dug deeper into the industry, just what I ended up seeing completely changed the course of my career. And really what led that was the fact that truck drivers have a life expectancy 16 years less than the average population. And 16 years, I couldn't imagine losing almost 2 decades of my life just because of my career choice. And, when I heard that for the first time, thinking about my experiences with the drivers in the clinic and learning about the industry as a whole, and just, I don't think anyone's career should define their health, but that's exactly what's happening. And it honestly pissed me off, and like it still does. And it was at a point of like, how can we just ignore this? And I decided I couldn't. And I started a corporate health, corporate wellness company called Supply Chain Fitness. And so for the last 3 years, I've been working with, dozens of trucking companies, a bunch of insurance companies like Nationwide Insurance. I've been able to be flown all over the country and even internationally now to speak at different trucking conferences about this topic, and just spent hundreds of hours talking to drivers and just really getting to know them on a personal level. And throughout that, experience, I kind of say, the last 3 years have been me getting my MBA in trucking, just because I wasn't in the industry previously. And so as I got deeper into it, this one thing that I continued to see over and over again was this explosive surge of chronic diseases across the whole trucking industry. So diabetes, obesity, and heart disease. And what I recognized was that it's a much bigger issue than most people recognize. And the VPs of HR and benefit providers that I was talking to on the wellness side of things were talking about, because they're self-insured on the health insurance side of things, and 86% of all healthcare costs in the United States are directly associated to chronic diseases. They were talking about how much money they were spending on managing these employees, specifically drivers that had these chronic conditions, and that all of the other solutions out there had really just dropped the ball and really missed the mark, because they were clearly built for someone who worked in a cubicle, and they didn't have any other options for their drivers that actually fit the lifestyle and culture of their employee base. And so that, over thousands of drivers that I've worked with, and also, dozens and dozens of conversations with, benefit providers and VPs of HR, really just opened up my eyes and saying, this is actually the path we need to go on. It's the biggest opportunity, and it's the thing that drivers are struggling with the most, and really probably the biggest impact to that, decrease in life expectancy, because 7 out of every 10 Americans die from a chronic disease. And so we started Off Shift beginning of this year. We've been bootstrapping it behind the scenes, and we're, I guess, now publicly announcing it, but, announcing it publicly, before the end of the year.
Awesome. Yeah, there's a lot to unpack there. And
yeah,
where I want to start with that is coming into this industry, as a new outsider, what was that like? I know you mentioned these drivers came into your clinic, you worked with them. Since then, like we mentioned in the beginning too, you've kind of been on these podcasts and you've been to all these different associations. What have you seen coming into the industry, building these relationships, getting to know all the major players, but also every single truck driver, the role they have, and how unique this industry is, like you mentioned, compared to other industries?
Yeah, I mean, I think the first thing, I've got a couple of thoughts on this, but I think the first thing being, number one, the trucking industry is small, or like big. It's a really big industry, but it's a really small field, right? And everyone knows everyone. And what I've recognized and I've seen firsthand is that, if you come in and embrace the industry and, you want to help and you see a big need and you're like, I'm building for this industry, the industry embraces you back, and they want people who are hungry, who want to innovate and want to build specifically for them, because everyone in trucking knows trucking is a unique industry. It's a unique lifestyle for every employee, if you're behind the wheel or in the office or in the warehouse. And a lot of the times, these vendors come in and they're selling the same solution to, the tech company down the street as they are to the trucking company. And it puts a really bad taste into, executives at these companies, and also, probably most important, the actual employees using the benefits and using whatever vendors that they're selling into. And it's very clear that these companies don't understand trucking and don't understand the employee's lifestyle. And so I've just been embraced. It's been amazing. It's definitely been a learning curve. And there's been, me being very humble about the fact that I didn't grow up in this industry, and I haven't worked, as a driver, I haven't worked with at a trucking company, but very hungry to learn and wanting to get different people's perspectives and share my perspectives. And I think there's a lot of value in coming in with that attitude. And also, I think there's a lot of value in someone coming in who's not from the industry, coming in saying, I'm going to learn the industry, but take in what I know outside of the industry from a health and wellness standpoint specifically, and adapt it to what I learn about the industry. And I think the other aspect, and I'll tell the story of after when I decided to start supply chain fitness and just got started in the industry, I didn't know a single person, like I said, and where I was like, where do truck drivers hang out? I need to talk to some of these people. And the patients in the clinic were like, you need to check out some of the Facebook groups. That's where a bunch of truck drivers are. So I joined probably 20 to 30 different trucking Facebook groups, which for someone who's not in the trucking industry, who's never talked to a truck driver before, is the Wild West, man. Like it was awesome. It was just funny. Some of the things that you hear drivers say, and you're like, dude, this is like public. People are going to be able to see this like for the rest of time. This is like stored on a server somewhere and is going to outlast humanity. But you're going to argue about that. That's fine. Awesome. So I just posted in a bunch of groups and saying like, hey, I'm looking for beta testers. I have this program that's a fitness program for drivers, and I'm looking for someone to give me feedback. And out of probably thousands of drivers that saw the initial post, I got 20 drivers to sign up and be a beta tester. I was on the phone with them every single week, getting to know them, getting their feedback and saying, hey, I know fitness, but I don't know your lifestyle. You tell me what works and what doesn't work, and we'll adapt this. And still am friends with some of those drivers to this day that were a part of that group. And it was just the spark of all of this, of just like learning the lifestyle of a driver, adapting the program, learning a ton, and really opened up my eyes to the industry and the opportunity we had, and just kind of continued building the momentum from there.
So there's a lot there too that I want to unpack. And something that you touch on is, in this industry, partnerships are so important, right? We all want someone to come in and build purpose-built solutions for trucking. I think you're doing a great job of that, of going super niche, going deep, and getting to know this industry specifically. So whenever you reach out to these companies, who are you partnering with? You mentioned a lot of working directly with drivers, but as this business is growing, do you work with HR, safety, driver recruitment, retention? What kind of people are you working with? And then how does that implementation look like?
Yeah. So with OffShift, because it's on the digital health side of things, really focus on chronic disease management. We are working with right now the mid-sized trucking companies, I would say between 250 to 1,000 W-2 employees who are self-insured on the health insurance side of things. So they are not buying a policy, straight up from Blue Cross Blue Shield, United, Aetna. They've actually brought everything in-house. There's a gray area there where I won't bore you with the details of the health insurance world, but basically they have a pot of money or a budget internally as a part of the or as a part of HR and benefit division, and they write checks for every healthcare cost or every healthcare vendor they have for their employees. And they become self-funded and basically spread the risk of healthcare costs across their employee base. And so we work with them as their chronic disease management, or preventing and managing high cost hospitalizations, emergency room visits, high cost prescription costs for employees who have diabetes, obesity, heart disease, prediabetes. That's really our main focus, these obesity-related, lifestyle-related chronic conditions. We typically work with the HR benefit team and become a vendor in the health benefit side of things.
Yeah, and then as that partnerships gets rolling, what does the implementation look like, and what are some of the best practices you see? And I know it's difficult to just say, hey, employees, you now have access to X. So what are some of the innovators in this space doing to make sure drivers don't just, sign up for another program? Because we all know there's a million things we're asking the drivers to do. How do we make sure that they get involved and take part in these programs?
Yeah, I mean, I'd say we are innovating. I think the fact that we're building specifically for the trucking industry gives us a huge advantage when it comes to internal marketing. Right? Because what we always say from the coaching standpoint when we're building our program for the drivers is that we want to smack drivers in the face that this was built for them and their lifestyle. And when it comes to the internal marketing at a company level and talking to the executives and the HR team, we want to do the same exact thing. Trucking companies, like I said earlier, their whole business runs differently than a tech company or whatever, any other company, right? Their whole organization is different. The lifespan of their employees is different, and the different touch points they have with their employees are different as well. And so when we've built the internal marketing, we want to smack the HR team, the executives in the face that we understand their business, and we've built our solution to fit perfectly in to how they operate. And so doing things like the normal things on the benefits of like email marketing, text messages, signs up in the terminal or in the off, all these different things being incorporated into their benefit packages, being on their, benefit vendor list, all these different things. Those are like the check the box, right? That's not really innovating anywhere. But where we're innovating is actually being able to integrate into the operations and the culture of the company, and being able to have a call to action during orientation, having a call to action during safety meetings, because so many people say health and safety, but only talk about safety. They really lack the health part of it. The big one that we found successful is having a call to action for our program 60 to 90 days before a DOT physical, or immediately after they get handed a temporary card and they're like, I need to do something about it. And so finding those different touch points in a driver's just experience with a company, where we can have personalized call to actions that fit organically into how these companies are already interacting with their drivers, and having things with their ELDs and having it very easy for drivers to sign up. All of these different areas are ways that we're trying to just make it as smooth and simple for drivers to say, I get what they're trying to do. I want to fit this into my life, because drivers are humans, just like you and I, just like everyone listening to this. They care about their health. They want to be healthy. I think there's just a lot of the times within the culture of the industry and some of the demands and getting paid per mile that they drive. A lot of the times health has to be put on their back burner. But if we can provide a solution that doesn't say, hey, we need to flip your whole lifestyle 180 degrees upside down, and you have to change all these different things, that's not realistic. If we can come in and say, hey, we know you sit for 11 hours a day, you can't do anything about that. I'm not going to shame you for that. But here's some ways that we can integrate a healthier life into your day-to-day life. Let's help you get a relationship with a primary care doctor, because 50% of truck drivers don't have one. Let's help you adhere to your medication. And if you're having any, side effects to it, let's get you to the doctor so that, we can take care of that and adjust it. Let's help you eat healthier at the truck stop. Let's help you be physically active, either around your truck or at home if you're on home time, or in the back of your truck, which is our most popular program. And really just like find ways to fit in healthier habits, into what they're already doing and not adding more to their load.
Yeah, there's, again, a lot to unpack, because you do such a great job of really understanding this business and getting to know these drivers. So kind of talk me through, what are the biggest challenges these companies are looking to solve? I know you mentioned this health and safety aspect is so important to trucking companies' culture. How does health and safety work together? And kind of tell me where the programs tie into all of that to bring together this holistic strategy you're talking about.
Yeah, so for us, we're really focused, like the number one ROI is cutting down healthcare costs. And I think that is like the biggest thing when a company is thinking about bringing on a vendor. Yes, there's like a cultural standpoint. There's a feel good, like we want our drivers to be healthier, but you are all running a business, and we need to have a business decision on how this is going to be an ROI or create an ROI for our organization. And when it comes to making changes to healthcare costs is the strongest one-to-one ROI, specifically around those chronic diseases of, if we can prevent a driver from becoming type 2 diabetic, we can cut down $10,000 on average healthcare costs for that one employee per year, right? That's obviously a very easy, strong one-to-one ROI. Or if we can cut down, a driver going and getting, having uncontrolled diabetes or uncontrolled heart disease and having to be hospitalized or having a major surgery or a major, heart attack or stroke because we're able to manage those conditions, that's a huge ROI for the company. But being in trucking and being that the company is, they're in a safety critical environment, there's a lot of other areas within our organization that we call like trickle down impacts, right? I think it's really still adding to the ROI and to the sales opportunity, but I think there's still like a couple of layers between showing that ROI. And I think that's why we're really focused on the healthcare as the strongest one-to-one ROI. But you talk about, productivity, truck utilization. If we can help drivers be healthier, we can cut down the likelihood of their health, not allowing them to be behind the wheel and make deliveries and use all of their hours of service and, increase the utilization of each truck. You talk about retention and turnover, right? The average turnover rate for a trucking company is 90% year over year. The average turnover cost per driver is like just around between $8,000 and $9,000 per driver. Some companies say it's way more than that because they also talk about the loss of revenue they make because the drivers or the truck's just sitting there in the yard. But look at, the amount of drivers who are either having to medically retire, failing a DOT physical. And the number 2 and number 1 reason for a failed DOT physical is uncontrolled diabetes, uncontrolled high blood pressure, right? You also talk about the safety side of things and cutting down health-related safety incidents of driver fatigue, falling asleep behind the wheel. I don't think anyone would argue that, a healthier version of any driver is a safer driver, right? Less likely to fall asleep behind the wheel. They're going to be quicker reaction time. They're going to be more energized and alert. And I think everyone would agree. Yeah, everyone would agree that driver is just a safer driver. And if you've got a driver who has two drivers who have the same safety record, and the company has a decision to make, they're probably going to choose the healthier one as well, right? These companies want people who are healthy, who are taking care of their health and want to make their health a priority. And then I think there's another aspect of just work comp claims and cutting down the likelihood of a musculoskeletal, surgery, of, torn rotator cuff or a backache or, hurting their knee or neck, and obesity and some of these other chronic conditions definitely have a place in, increasing the likelihood of those happening as well.
Yeah. And then I know you talk to a lot of different companies through these interactions, and data is so important here, making sure you're paying attention to these signals. I think one of the ones you mentioned was that DOT physical. They're kind of handed that temporary card that's a great sign that this is a time to intervene. What are some other metrics that, these innovative companies might be watching that can help them improve their driver fitness?
Yeah, I think the biggest one for us and how we're looking at it is if you talk to any HR and benefit provider at a trucking company, they have this great suite of benefits that they offer. They've got all these different things. But you ask them, okay, tell me about the engagement of these benefits, right? How many of your drivers are going to get blood work? How many of your drivers are utilizing, the mental health or, the EPA program that you have in place? How many of your drivers are utilizing these aspects? And what we're recognizing is that we have an opportunity because we speak the language of drivers. We're creating that really industry-specific internal marketing and creating engagement within the driver population that we actually can be the top of the funnel or like the front door into the rest of the healthcare system for drivers and other employees at these companies and actually increase utilization of other health benefits and also increase utilization of preventative care as a whole. And so that's how we're looking at it. And like how I think about it is when we go into a trucking company, they have this suite of health benefits that we will be added to, and we want to help all of them rise, right? We're not competing with any of them. We won the contract already. We already competed and we won that. So how can we just get our members to utilize other vendors and other aspects of the healthcare system? Because that overarching, when it comes to long-term chronic disease management, having access and touch points to the rest of the healthcare system is a huge area and a huge, I guess, key point of, hey, we're on the right path and this driver is, taking care of their health. And even if it is, getting help from a mental health professional, right? We all know that definitely contributes to lifestyle-based conditions as well. And their motive care about their physical health.
Yeah, and then you touched on something there again that I think would be super interesting to dive into. Could you kind of talk to the challenges and solutions for companies helping their drivers with mental and physical health, and kind of what the experience is like from all of those drivers you've connected with?
Yeah, I mean, I can't really speak too much on the mental health side of things. I can just speak from guess the sideline, if you want to put it that way, of, truck drivers have 2 times higher likelihood of being depressed compared to the average U.S. worker, right? And there's a lot of isolation. There's a lot of mental stress that comes with the job as a whole. And a lot of the times I hear a lot of drivers who are just scared about, there's like a taboo effect of getting mental health. And so I think there's a real good opportunity for the company to kind of lead the way and be like, hey, we have these resources. We want you to use it. We care about your mental health, and we want you to talk to the professionals and get ahead of it, because at the end of the day, if someone is not mentally healthy, the likelihood of something bad happening behind the wheel and also them leaving your company is much higher than if a driver is healthy mentally and also healthy physically.
Yeah, and then from there, let's kind of dive into some of these programs that you take these drivers on, right? So you mentioned working out around or in your truck. Kind of dive into that. I've seen some crazy things. I've seen, pictures of someone doing push-ups off the fuel tank of their truck, or like you mentioned, working out in the cab. What are some programs you're seeing that are most effective for these drivers?
Yeah, I mean, I think at the end of the day, the biggest thing is how can we take out as many hurdles as possible for drivers to make their health a priority? And so from a physical activity standpoint, one of the biggest hurdles for drivers, especially over the road drivers, but I'd honestly argue local drivers as well, who are working long hours and trying to, then has to deal with stuff at home. One of the biggest things is okay, how am I supposed to find a gym, find a gym that has semi-truck parking, then go to the gym? What am I supposed to do once I'm in the gym? And then, okay, awesome, they have a shower, so I can get a shower in there. That's cool. That's cool. But then I have to go to the truck stop because I can't park at the gym overnight. I have to go to the truck stop, hope there's still truck parking there, because by the time I get done driving, get a workout in and get back to the truck stop, maybe a lot of the parking spots are already filled. And so what we said is look, we don't need a gym to be physically active. There's so much opportunity. What we said is drivers don't need a gym, right? They can do stuff right in their environment, and we can turn their truck into a gym and help them either do it right outside of their truck, if it's nice outside and they want to get outside and get some fresh air, or our most popular program is actually the inside the truck program. And so we can do it right in the back of the cab and have drivers do exercises, stretches with their body weight, or give them a resistance band. And with that, you can do almost any exercise that, you want if you have the creativity to do it. And then through that, have a coach personalize a program that's personalized to their fitness level, what equipment they have, their goals, their starting point, right? That kind of goes back to the fitness level. And then also the biggest aspect of time. That is the biggest barrier that drivers have. And we've got stuff they can do in 5 minutes or less. We've got stuff they can do in 10 to 15. I found 20 minutes to be this really good sweet spot in the morning or in the evening. But we also have stuff drivers can fit in during their 30-minute break, and they can do it right there. And we're also experimenting and finding ways that, look, how can we just fit being physically active into your day-to-day life? And, when you're waiting for your fuel, how can we just, every time you get in and out of your truck, you do a couple of air squats, or you do some push-ups against your truck, or, you walk around your truck, 5 times when you're waiting for fuel. finding different ways that we can increase from a habit-based standpoint and increase the physical activity is something that we're always looking to do.
Yeah. And then how are you incorporating something like, reminding them to be active whenever you have X hours you have to drive in a day? What are some ways that they can make sure they're, hitting a stand goal or making sure every couple of hours they get some movement? And then maybe how does that incorporate into turning that truck into a gym, if you want to go into that too?
Yeah, so we don't have stand goals. We don't try to tell them they got to move for every couple hours, right? Because sometimes that's not realistic, right? What we do is they jump on. The whole experience starts with them building an actual relationship with their coach. And from there, the coach personalizes a plan with them. And it's really focused on how can we start them off with the first healthy habit that's calculated to be the one that they are most likely to succeed at, given, their lifestyle, their starting point, and their chronic condition, right? And so for some people that might be on the nutrition side of things. For others, that might be physical activity and being physically active, getting more exercise in. And so from an exercise standpoint, it's like, number one being, what are you doing right now, right? Let's get the baseline. And then we know from the research that from a pre-diabetes weight management standpoint and cutting down the likelihood of them becoming type 2 diabetic is that if we can help someone lose 5 to 7% of their body weight and keep it off and be physically active for 150 minutes per week, we can cut down the likelihood of them becoming type 2 diabetic by 57%, which is that's life-changing, right? If someone doesn't become type 2 diabetic. And that's also a huge cost savings for the company. And so we have that North Star of being physically active for 150 minutes per week. You can also add in like full body resistance training 3 times a week as well when you look at the physical activity guidelines and the research around that as well. But we get the baseline, and the most important part for us is like consistency is king. It's the name of the game. And consistency for you and I might be, hey, we're going to do something physically active every single day. But for some drivers, it might be, I'm going to go for a 10-minute walk every Monday. And I'm consistent on that. And doing a 10-minute walk one time a week is a huge step, both mentally and physically, in the right direction from someone who doesn't do anything. And from there, we just find that starting point. We get some wins under their belt. We build up some momentum, and we just start chugging away of slowly progressing it. And that might go from a 10-minute walk once a week to a 15-minute walk once a week, or 2 10-minute walks. It depends on what their schedule is, what's realistic for them, and what they're excited about and what they're motivated to do. And that's the personalization where it comes in. And that's kind of how we go about it, and we personalize it for each member.
Yeah, and I was listening to your podcast episode you did with Kevin Hill, and I think he asked you something about some metrics to watch as well. And something that stuck out to me was you said that the one you're watching is how many vegetables you eat. You're trying to increase that. So I like that it isn't just, as you mentioned, we have to hit X stand goals. It's not this static goal that may not be tailored to the realities of a certain driver's situation or their goals. So could you kind of dive into a little bit about that nutrition side of things as well, and then how you work with a truck driver on that, especially with being on the road?
Yeah, I mean, nutrition is like very culturally driven, right? I mean, food can be fuel, but it can also be a whole lot of other things, and there's a lot of emotional ties that come with it, and there's a lot of people from a cultural standpoint as well, that like food is a big part of their culture and their family and how they, what they do for fun, right? And I think for a lot of people, and this is outside of trucking, but I think the lifestyle of trucking makes it even more difficult, is when people think about making changes to their health, it's like, I'm going to start this diet. I'm going to change everything about my whole life. And I'm going to force myself to not cheat and not do anything that's outside of this plan. And they do that and hold on for dear life for about a week, and then they fall back to square one because they set themselves up for failure, and it's unrealistic and unsustainable. And what we focus on is, let's just like I talked about physical activity, let's focus on one habit-based change that you can do anywhere at any time. If you're at McDonald's, or you're at the Love's truck stop, or if you're cooking at home meal planning at home, or you're preparing it in the back of your truck. We can focus on this. Let's just nail this down, make it a part of your day-to-day routine, and then let's start just stacking other habits on top of it. And the whole mindset we have is your health goes with you for the rest of your life. So let's set this up from day one in a way that you can see yourself doing it for the rest of your life. Not something that you're like, I'm going to do this for 30 days and then I'm going to go back to eating 4 roller dogs and a liter of Pepsi every meal, right? It's like this roller coaster. And a lot of the times when, with the traditional diet culture that people have, you get into your 30s, 40s, 50s, and a lot of these people have like 10, 20, maybe 30 different times that they've attempted to make a change and they failed because they set themselves up to be unrealistic and unsustainable. And it feels like a failure, and it feels like almost like this is not even worth it at this point. I've tried in the past. I can't make it happen. And I think it's really unfortunate that a lot of people get to that point, and we're really trying to reverse that and say, look, sustainability and consistency is the name of the game. Even if that is moving from a large Coke to a medium Coke on a consistent basis and cutting out 20 grams of sugar a day, it's a step in the right direction, and we're moving towards a healthier you.
Yeah, and there's so many good nuggets that you touched on there, and I think it's just so important to remember that incremental change is still change, and those small steps compound. And I like what you said about habit there and how important habit building is. I haven't read Atomic Habits. I know that's the big one, but they talked about this
classic, yeah,
habit that, around 3 p.m. everyone kind of gets that antsy feeling, and a lot of people would reach out to maybe get a snack or go grab a cookie. And what can you just replace that habit with? So what is one more actionable insight you would give to a driver today that they could implement to make a small change that could possibly lead to a bigger impact like this?
I would say, I'll give you 2. The first one's going to be like dull, but it needs to be said of like, today's the best time to start. You got to do something. There's never going to be a perfect time to start. And a lot of people in their head have, well, this is a bad time of the year. This is a bad time for me personally. And it's like, well, okay, so if you're going to make this change, do you expect to make, like, you want to make this change for the rest of your life, right? Do you expect there to be other times in your life where it's difficult or it's not the right time or there's a lot on your plate, and you want to consistently do those changes throughout that time period, right? So why wouldn't you just start now? And then when it becomes easier, the load gets off, it's even easier for you and you can continue making a progression. But then, when shit hit the fan, sorry if I can't curse, whatever, and then
we'll beep you out.
There you go. Then you've been there, done that, and you know how to handle it because that's where you started, right? And then the second thing I would say is, you are sitting there, take a step back, look at an average day in the life of what you eat, what you do physically, activity, what you do for your health as a whole. Most people can find 1 or 2 low-hanging fruits that like doesn't really change your day-to-day that much. And maybe it's something you've been motivated to do, or you feel as though it would be an easy switch that would just push the needle in the right direction from a health standpoint, and start there. That might be, instead of grabbing the Twix bar, you're grabbing a protein bar at Love's Truck Stop. That might be, instead of getting a large fry and a large Coke, you're getting a medium fry and a medium Coke, or you're getting a Diet Coke to cut out all of that sugar, right? Finding those low-hanging fruits and adding, kind of overlapping the low-hanging fruit where it would be an easy starting point with what you're motivated to do, like create that Venn diagram, and right in the middle, that's a great starting place for you.
Yeah, and I think that is the most motivating thing you can do, right, is make that first step, and then the next one you get a little bit of momentum on, and that will keep you moving along. As we wrap up here, we have one more question that we like to ask all of our guests. So what is your bold prediction for the future of trucking?
Oh man, I think that my bold prediction for what we're going to do is we're going to not let trucking define people's health, and the life expectancy is going to be cut down a whole lot, and we're going to give millions of drivers in this industry literal years back on their life, and not only at the end of their life, but also better quality of life throughout the years in trucking and outside of trucking as well, to enjoy with their family and friends. So that's my bold prediction, and that's what I wake up every day excited to do.
It's a powerful mission. I think something everyone can get behind. So, Mark, as we close out, where can the people find you?
Yeah, so I would say right now we're about to launch Offshift. So our website's offshift.ai. Supply Chain Fitness is still available, and that's what all our social medias are. But if you're on LinkedIn, just connect with me, Dr. Mark Manera on LinkedIn. And, we got some big things coming up in the next, 6 to 12 months, which I'm really excited, and I'll have to be back on to share some updates.
Awesome. We look forward to it. Well, Mark, thank you for the time, and thank you for sharing your insights. This was a great conversation. I know everyone can find some value in it. So thank you.
I appreciate it. Awesome. Jacob, thank you for having me.